Hi, thank you for stopping by our poster. I'm Jessica Allen. I'm the family leadership trainee at the Pediatric Pulmonary Center at UAB and Children's of Alabama. This is our trainee research project. We were interested in investigating the evaluation of telehealth among individuals who had received it in a sleep and pulmonary clinic, as well as any accessibility needs among those who had not yet received a telehealth visit in our clinic. We all know that telehealth is being utilized by a growing number of healthcare institutions. And of course, this is in part related to the global events related to the global pandemic of COVID 19. But even before COVID 19, telehealth care use has certainly increased. And there's been some research on the potential benefits, which have included addressing provider shortages, increasing access to care, and even potentially reducing costs. It's possible that telehealth might provide access and even on a related note, promote resiliency among patients and families, including those who are children and youth with special healthcare needs. But in spite of this widespread and increasing use, there has not been much research specific to telehealth use and accessibility within maternal and child health settings. So, the purpose of our current project then was to investigate how parent and patient and caregiver families who had had a recent telehealth visit within our sleep and pulmonary clinic, how they had perceived those experiences. So, for our study, we call that the evaluation group. And we also investigated any accessibility needs as well as perceptions of telehealth of patient families who are patients in our clinic, but they had not yet received a telehealth visit within our subspecialty clinic. So we included caregivers and parents of patients. Caregivers had to be at least 21 years of age in order to participate in the study. They would have received either a telehealth visit, and that could be video conferencing or by phone, um, or an in-clinic visit either in late 2020 through early 2021. And then they were asked, after an informed consent, to complete either an evaluation survey, those who had received services using SurveyMonkey, or an access survey, those who had not yet received telehealth services in our clinic, also via a SurveyMonkey tool. We ended up with 55 respondents in the access group, so not yet received services, telehealth services, that is, and 40 who completed the evaluation survey. So I'd like to just highlight for you a few of our major findings. Most of our respondents were parents. They were predominantly female. Although we didn't look at group differences, this is something that we should do in our next set of analyses. Most respondents were white, non-Hispanic. That was a slightly higher proportion in the evaluation group. Most folks had had some college. Of note, the access group, a majority, just over half, had public insurance, whereas less than half in the evaluation group had public insurance, whereas almost 40% in the evaluation group had private, only just over a quarter in the access group had private insurance. A small percentage had both private and primary insurance, private and public. In terms of primary diagnoses, those who had not yet received a telehealth visit, the highest primary diagnosis reporting was 48% asthma. Second to that, about a quarter of those respondents' child was diagnosed with cystic fibrosis. In the evaluation group, it's almost a flip. There was a higher proportion, as in 40%, that had cystic fibrosis. So these are folks who had participated in telehealth services, whereas just around a third had asthma. So we asked both groups their perceived advantages and disadvantages of telehealth services. Those who had received services are the orange bars, and the blue bars are those that had not yet participated. So both the access and evaluation groups felt that an advantage of telehealth visits was that the potential to avoid infections. In the evaluation group, they also liked that they didn't have to drive to the appointment, that they didn't have to miss school or work, and maybe even that the overall appointment was shorter. In terms of perceived disadvantages, the evaluation group noted less of those. They noted that a possible disadvantage could be if the physical exam was not as thorough, or could something have been missed in the telehealth visit. Whereas the evaluation group reported some of those things higher. So those who had not yet participated in telehealth saw more disadvantages or more potential for disadvantages. Overall, the evaluation group, most respondents, 66%, said that they would do this again, that at least some of their future visits they'd like to have be telehealth visits, whereas less than half of the access group was interested in telehealth for some future visits. The evaluation group, almost three quarters, reported that they had everything they need in order to have a successful visit. But you'll note that just at half of the access group felt that they had everything they needed, with instructions for a successful visit, better internet connections, and having home health equipment being some of the access needs that they reported. We did see a relationship of high speed internet to some demographic factors, such as low income, college education. We also saw that distance from children's and income were related, as was computer access and income, and race and income. Overall, participants had a overall willingness to participate in telehealth services. They reported high satisfaction, but even in those who said they would still participate in telehealth, there was at least a third or more who wanted to learn more about telehealth, including that information packet with insurance coverage information. And finally, future work in this area is needed, including clinical outcomes to address some of those concerns. Are physical exams as thorough? That's a research question that we can certainly answer. And understanding better group differences in users versus non users of telehealth visits.